All right, good morning, everybody. Thank you so much for joining us for this first meeting of 2026. I hope everybody had a great Christmas holiday and a great New Year's celebration. Hope everybody's coming into the year happy and healthy and ready to go and with a new start for 2026. I'd like to call to order this meeting of the Health and Wellness Advisory Committee for Wednesday, January 7th. 2026. It is 8:30 a.m. And if you let's see, if you would, we need to approve minutes that Paul sent out earlier this week for November 5th and December 3rd. Can I get a motion to approve, please?
I'll move.
All right, we have a motion to approve. Can I get a second?
Second.
All right, we have a motion to approve and a second. Any additions, deletions, any other comments? If not, all in favor of approving those minutes, please say aye. Aye.
Aye.
Hi.
Any opposed? The minutes have been approved. So this morning, Jennifer Brush, Executive Director, Charleston Dorchester Mental Health Center, Office of Mental Health, is going to give us an update and mental health wellness for 2026. Jennifer?
Thank you. So let me make sure I can share this correctly. When I have two screens, I never know which one's going to come up. So let's see.
You're up.
All right, let me put it in slideshow.
And Kevin, for those who, Jennifer is our director for the executive director for Charleston Dorchester Mental Health Center Office of Mental Health now.
Yeah, he actually said it right. I was impressed. Even I have a hard time. That's where I work now. So are y'all seeing the first slide right now?
Yes.
Okay, good. Yeah, so Paul asked me to talk a little bit about post-holiday blues or stress, and I looked up some things that kind of I hope you all will find interesting and helpful to yourself. As the holidays, I guess, officially ended on Monday when most of us came back to work. If some people might have worked through and some people might not have, but everybody, I guess, went back to school yesterday, and the holidays are officially over. A lot of people probably hear about, that people who live with depression, it's harder for those folks to manage the holidays because, as you know, holidays can be really happy for some people and not as happy for others. But people don't talk a lot about post-holiday blues. And even when Paul asked me, I thought, okay, well, that's interesting. But it's true. There are a lot of things that we all have to settle into after all the hype and busyness goes away. Instead of happily settling back into normal life after all of the decorations come down, if you do those, and the parties are over and the planning, that there's an intense amount of activity that people have from pretty much Thanksgiving to New Year's. And so people wonder, well, after all that's over, why am I not feeling at peace and rested and happy to start the new year? And there are reasons for that. So there's a lot of things that happen. We're all planning things, we're anticipating, we're buying gifts for people maybe. It's exciting time, it's the holiday season, Charleston, Mount Pleasant, our whole area is decorated when you drive around, and you might have guests come visit, you might go travel to see your own family. So there's a lot going on from pretty much from Thanksgiving to Christmas. And then kind of it all comes to a screeching halt, right? All that activity is done, everything's over, and you're kind of back to normal. And it's a big change in everyone's lives when that happens. So for a lot of people, it can seem like depression and sadness, but really it's often really associated with a feeling of loss. And I'm going to tell you a little bit more about how your brain plays into this to kind of make it seem more like depression than just, oh, everything's over. So our brains are really interesting computers, let's say. They really do a really good job of organizing lots of information for you. And your brain stores memories and neural networks, and everything's kind of joined together according to like things. So your feelings of happiness and memories of happiness are all in the same place, and your memories of loss are in the same place. So when you have a mood or a feeling, it is an entryway into that network of other like feelings. So what that means is when you have an emotion, it is one of the most powerful triggers to open a network of memories that also associated with that emotion. So it can bring back, if you've ever gone to a funeral, even if someone that you didn't know, you were going maybe for someone at work and didn't even know the person, but suddenly you're sitting there maybe about to cry, right? You don't even know the person. It's because your brain is going and reaching in and looking for memories that you have that are like this. So when you do feel sad, your brain goes and finds other things like that to kind of intensify that feeling of sadness. If loss is the feeling, then you're going to open up other feelings of loss. And so after the holidays, that's why it can seem intensified, because you really have lost the stimulation. So for people that do live with depression over the holidays, it can be a lot tougher on some, and then for some, it can be a well-needed diversion from their normal lives and how they normally feel, because you are busy and you're trying to keep up with everything. And so for some people who do live with depression, after this is all over and everything's settled and everything stops, their feelings can be more intense than other people's. Um, how do you bounce back from this? One of the most important things I think to figure out is trying to identify what your mood is and how you got there and what it's about. Because you can get stuck in a negative network of feelings if you continue to try to, your brain's going and grabbing other like feelings. I don't know if you've ever been in a kind of in a sad mood. And what do we sometimes like to do? And when we're in a sad mood, it's kind of a weird thing, but I've done it before. You might start playing sad music, and then you want to keep playing that sad music. And you can really make yourself it really a lot worse than you when you started, just because you're helping your brain go and gather up other things to make it worse. So identifying that it might have to do with the adjustment to less stimulation, and your house is now empty and your guests are gone and the Christmas smells and the food is gone, and you try to identify where it came from, is kind of the best way to kind of step out of that sadness and that loss feeling. So I got 9 tips for you on how to kind of escape the holiday blues network that your brain has, and it can help intensify your feelings of loss or sadness. One of the things is call a friend. Don't text them. Call them and ask them about their holiday, or ask them about positive things about their life, so that you can begin a conversation about positive things. And again, your brain will respond with other positive things. That can always help to talk to somebody that you know and love, just about anything, but keep the conversation positive. Go outside, even if it's raining. Take a walk in the rain. Get some fresh air. Park farther away from the grocery store so that you have a longer walk to get there. For people who are kind of alone at home, and it really does, you had a house full of people and now you don't. I mean, don't go through the self-checkout. Purposely go through the line where you have to talk to people. Try to interact with others and kind of keep some of that interaction going. Other things you can do is you can reread maybe cards you got for Christmas, or greeting cards, or emails from friends or family, or even look at old pictures and try to bring positive memories and positive thoughts into your head. Even some of the junk mail that you got over the holidays, you might want to read that newsletter about the neighborhood that you never got around to. Things like that can also kind of step you out of that network of your feelings about feeling loss or sadness. You knew exercise would be on the list. It always is. Endorphins really do help people's stress levels year round, all the time. And obviously, if you're starting to feel like you're losing weight, if that's your goal, I mean, that's obviously going to get you in a better mood too. Um, Looking forward and not backward is important. Making even small goals for yourself for the new year. Think about, I mean, one of the things I do in January is I love to camp. So my husband and I will go and we'll pick all of our camping dates for the whole year. So then you have something to look forward to again. When you get back from a vacation and you're kind of sad and you're like, wow, that was a really fun vacation, but now what do I have to look forward to? And you get kind of like, huh. That's why you can always continue planning in the future and can continue planning fun things that you like to do, can also help you. Another thing to try to do is cook something new. Cook something that doesn't smell like the holidays. Cook something you haven't done before, or start a new book. Just kind of start over a new chapter as you start your new year. And kind of sliding out of the holidays, stepping out of the holidays in everything that you do. Cleaning up your house and get rid of, put away all your ornaments. Just you might want to decorate differently or things like that, but just kind of put it behind you and start fresh. Getting enough sleep is, of course, always on a list for health and wellness. We're all supposed to have 8 hours of sleep. I don't come close to that. I wish I did. But it is really important for your health to get enough sleep at night so that your brain can function the way it's supposed to. And just trying to be mindful of what you're doing and taking charge of your life, and goals are important for people. It's one of the things we always ask people in mental health, what are you looking forward to doing, what are you trying to do, but don't make them too big because then you'll feel like you're failing. Don't bite the whole elephant. You just want a little bite of the elephant. But if you kind of start over and get a kind of new outlook on what I'm going to do for this new year, you can say Happy New Year to yourself and move forward, and hopefully, be not stuck in the well of being depressed about the holidays being over. And I'll tell you, when I was looking up information to share with y'all today, I got all this kind of from Margaret Warenberg. I put her website on here. She's got 11 books about anxiety and depression and other things, and she's a world-renowned speaker. You may find some things you might be interested in, so I actually just linked you to her books, but that will take you to her website. All right. Am I not sharing now, or am I still sharing?
You're sharing. We can see the slides along the left and see your
Oh.
resources page also.
Let me see. Oh, here we go. All right, are we
There
back?
you go. Yep, you're back.
Okay, good.
We see you.
All right. Does anybody have questions or anything about the presentation?
Anybody? Well, thank you so much. Anyone have any questions? Jennifer, let me just ask you, I guess, real quick. I mean, a lot of these are things we can do on our own and all. When do we know it's time? I hear a lot of people heard it through the holidays. Oh, I've got my happy pills or whatever. When do we know it's time to go get happy pills rather than trying to do these exercises and trying to do things naturally, I guess?
I'd say when things, I mean, a lot of people can feel sad, like even if you have a loss, somebody dies that I mean, there's a normal amount of grief time, it's different for everybody. But I mean, if it really I'd say if anything is affecting your daily functioning to a point where you can't get things done like you need to do, whether it be go to work or just things around your house, when it really affects your daily functioning and you can't quite snap out of it, that's when I might reach out to somebody and try to get some help.
Okay, thank you. Anybody else? Well, thank you. Great presentation. Paul, did you have something? I saw you moving.
I got to remember I'm not cut my mic off. Jennifer, what you put out there is so powerful, but I also I had suicide entered some friends this holiday season, and sometimes I don't know how to talk to those my friends and how to do it. And your 9 comments right there are pretty powerful. Is that what y'all would use sort of in the suicide of how to try to help people get out of their away from what they're having to live with on a regular basis of losing a loved one?
Well, if you mean if somebody if they're talking about suicide, someone that you know.
No, somebody that has had a family member that has passed from suicide.
Yeah, well, I would say anyone who's had a family member that has passed, I would definitely recommend they get some help, or at least by going to a support group. There are a lot of options out there for groups of people that are together that have all lost family members. I think that's a very lonely feeling to have lost a loved one and no one knows what to say to you, and some friends can tend to avoid you, and then you don't also, whatever they do say doesn't seem to be helpful, and so then you people can often isolate themselves because they don't want to be around others, they don't want others to worry about them. So I definitely would say in 100% of the cases, I think you should at least go to talk to a support group. And if that's not helpful enough, I would say maybe go talk to a therapist or some kind of support counselor. Because there's a lot of guilt put on people, in families. Everyone thinks, well, what shoulda, woulda, coulda, what could I have done? I should have done something different. I should have seen it. We've actually lost people here at the mental health center. Um, Years ago, staff here, and you think we have a 200 therapists here all looking at each other going, how did we not see that? So there's a lot of guilt can be put on people who feel like I should have known. And so I would say to everyone here, if you are concerned about someone, if you think someone is suicidal, you need to ask them, are you going to hurt yourself? Are you going to kill yourself? And do you have a plan? A lot of people feel suicidal a lot, but they're not actually going to act on it. But we literally, at every single counseling session we have here, we ask that question every single day, every single time. Because the one time you don't ask might be the time they go home and do it. It's a hard question to ask because people don't know what to do if they say, yes, I am. I mean, that's why people don't want to ask because like, what do I do now? But definitely what you do now is you get some help for them, and that's why I definitely 988 is out there, mobile crisis call centers out there for people to talk to. But yeah, I've shared some books. There's some good books out there for people who have lost family members, written by other people who have lost family members, and that's been helpful. So yeah, there's a lot of resources for folks who have lost friends or family members. But definitely it's a hard thing to understand, and I do feel like they definitely need help and often don't know how and what help to get. I hope that
Thank you.
answered your question.
It did. Thank you.
Jen, I have a question or just a clarification. So my understanding is that suicide, actually, there's more of an uptick after the holidays as opposed to during the holidays. We're frequently asked here at the VA, and probably y'all as well from news media, to really focus and talk about the holidays and depression and how to avoid certain well, to get help. And so I totally agree with the meetings and the other groups and such. But do you find that to be the case as well, that this is really the time while we're reaching out and working out, maybe if we have our own sense of blues, making those connections, and then if those symptoms or signs start showing up, to ask the question of the individual and point them to like the veteran crisis line or the 988.
Yeah, definitely. And even part of what I said in the presentation was that, yeah, that it can be a diversion for those who are already living with depression. And when all of it ends suddenly, just like a brick, it definitely, if you don't have someone to help support you, you can go south pretty quickly, so definitely good points, Jonathan.
And that was one thing I've been excited that Jonathan has stuck with us since his presentation 2 years ago, I guess it was, to us. But Jonathan came to our group looking for support for his community that's out there. And I just want to encourage that if we ever got anything that we can share, we just need to keep opening the doors so that we give Jennifer and Jonathan support groups that they can lean on us with either what we're doing in our communities or what we have available to share, because it does take a community to try to help get everybody through these cycles. So
Thank you.
All right. Any other? Oh, go ahead. I'm sorry.
well, Kevin, I did want to, I know he's not wanting to say anything, but I did want to introduce that Taylor Lee from our regional director of DHEC has joined us today. So we're excited to have him sitting in on our meeting.
Thank you, Paul, and hello, everyone. It's been quite a while since I've attended one of these meetings. Happy New Year to everyone! And I've just seen what my New Year's resolution is. It is to update my name tag, DHEC. We are now Department of Public Health. I see my colleague Lamar Hodges is here. Good morning, Lamar. But thank you all for inviting me back to attend, and I look forward to a great 2026. Thanks, Paul.
Thank you, Taylor. We are so excited to have you back on here. Thank you. All right. Anything else under mental health before we move forward? All right. So our next thing, I'm going to call on Lamar Hodges for our community health update. And Taylor, you're certainly welcome to chime in on this as well. So
good morning, everyone. It's a pleasure to be here. Happy New Year. As always, it's always a great opportunity to come to the Charleston Health and Wellness Committee meetings. Of course, this morning, as always, just want to give a few updates, just some information in regards to public health and what's going on. First things first, of course, as we are continuously within the Department of Public Health, still looking at our measles outbreak. Of course, just an update as it pertains to as of January the 6th, which was yesterday. We're still reporting about 214 cases of the measles since July 9th of 2025. As it pertains to this is in the Spartanburg upstate area. We've gone in a space where, of course, we're realizing that a lot of these cases are normally due to travel-related exposures, as well as close contacts. So what we're, just reminding everyone as it pertains to the measles is highly contagious. Just knowing that, of course, it not necessarily just with it being contagious, it could be in a space where it's contagious between 4 days before or after a rash or something is any type of symptoms is shown there. As it pertains to with what we're seeing is, of course, a lot of times in situations of understanding from what we're getting is as it pertains to that those persons with the measles, they're not necessarily aware of it. So it actually lingers at least 2 hours after it's been in it when that outbreak happens, or if a person is affected. What we encourage and what our recommendations, just of course, the vaccinations. Of course, when it comes to our public health departments, we always encourage that. Of course, just washing your hands, that sanitary, the 20-second rule. And then, of course, if possible, if you have been exposed, don't wait until you see the symptoms. Definitely contact a healthcare professional immediately. Of course, all of this information and, of course, briefings as well as updates as we have those throughout the time frame that we're experiencing the measles outbreak, it can be found on our website at dph.sc.gov. So just want to share that information as it pertains to the measles outbreaks. And we have not had any cases that have happened in the Charleston area. Also want to move forward and go in a space of just kind of doing some awareness month information and sharing that this month is cervical health Awareness Month. Of course, just want to just kind of give some brief information to those who are out there. We do, of course, have work with our Best Chance Network with our agency. Of course, South Carolina Breast and Cancer, Breast and Cervical Cancer Early Detection Program is what we consider them to be. And when it comes to it, they're working tremendously throughout our communities, especially within Charleston. You may see where we're partnering with our MUSC Health. They have a mobile unit that normally do the breast cancer and cervical screenings throughout the time frame throughout the year. So we are highly encourage that as it pertains to just especially for our women to make sure that they are doing those routine screenings. Of course, early detection and treatment can give women who have cancer a best opportunity to achieve a healthy outcome. The program, like I said, we work closely with MUSC Health Mobile Unit, especially throughout our county of Charleston. One of the things that I will share is if we can, do we have the slides or the information that I share with you, Paul?
I'll go look for it.
Okay, okay. And while he's looking for it, I just want to share that, of course, it just kind of gives those facts based off of from the South Carolina Cancer Alliance. Is where we, of course, we also one of our great partners that we work with closely when it comes to the information, just sharing how on average about 195 women are diagnosed with cervical cancer each year, and about 68 of them die from the disease itself. So that's about at least 1/4 of those women that are actually diagnosed with cervical cancer. So in the same sense, that's kind of what this information is being shared here. It just remains a problem throughout when it comes to women in South Carolina. And we just want to make sure that we having those regular participation in cervical cancer screenings, just so that we can make sure that we are reducing those rates there when it comes to it. It's very much founded commonly when it comes to those African American and Hispanic women. So we definitely encourage and want to make sure that that is one of the things that we're looking at as well. As it mentioned, one of the things about cervical cancer is highly one of the main causes is the HPV virus, and of course, with this virus, of course, it's from skin to skin contact. So, oftentimes in situations, you want to look at those risk factors in regards to how when it comes to cervical cancer and how we commonly are realizing that this is affecting our community. For those who are, smoking cigarettes, as it pertains to having 3 or more full-term pregnancies, just those kind of things that we're looking at that makes it a risk for those women who are diagnosed with it or very well early detection of it. One of the ways that we can prevent it, because we always want to go in the space of sharing that information as well, is of course being able to get the HPV vaccine, which is something that, of course, with our public health services that we provide. Oftentimes when our partners, we also even partner with our MUSC Health that provides a HPV. Their mobile unit also provides that services as well. So we oftentimes work with a lot of community partners in making sure that we are educating the community about this, as well as making sure that they are aware of how they can prevent it. Of course, when it comes to it, we just want to just encourage those early, just getting those breast cancer and cervical cancer screenings, routinely as it pertains to, there's a new year, let's start the year off on the right foot and making sure that we're getting those annual checkups and making sure that we making those appointments to ensure that we are all in great health for healthy people in healthy communities. I also, that is my update regarding the cervical cancer, as it is the awareness month. I also had to share, of course, some community events that are going on in the Charleston area. And I'm not sure if Paul has those as well. And it looks like he does. So awesome. So great job. So when it comes to it, just want to share some opportunities. And this is an opportunity for we can actually start with coming to in Charleston that there is an event on the 19th annual Edward Gibson Community Health Fair. It's happening on January the 19th down in downtown Charleston. They're going to have some fresh fruits and vegetables, also doing health and wellness information that they're providing, as well as a blood drive that they're doing. Like I said, I wanted to share that information out in the community, as of course, if there's opportunities for us to just be able to provide information and resources out there to everyone, just wanted to make sure that everyone is aware of those. And of course, as always, it's just a pleasure to be here and an opportunity to definitely share that information. Thank you so much.
Thank you so much, Lamar. Any questions? Well, Lamar, I did want to ask you, if I can, about the measles case. I think you said there's 214. Are those active cases? So, I mean, are they taking the numbers off as people have recovered, or are those active, or are those just total cases that have come up?
So right now, those are just the total cases. As it pertains to it, I do not have the information in regards to what that process is as it pertains to it. But like I said, what the information that was reported is kind of what I am reporting, which is basically what the total numbers are.
Okay. All right, great. And do we know what percentage were vaccinated or unvaccinated that have the measles?
Yes, that was in the report. It did share that, of course, only 3 of those persons who were vaccinated out of the 214.
All right. And are these primarily children or adults, or do you know that breakdown?
Yeah. So what we're realizing and seeing now, based on the report, is that it's more commonly found, which we are going into space now, doing a lot of education and bringing awareness to a lot of the schools, because there were some outbreaks in some of the schools, as well as child care centers. So and as well as churches. So it could be very well, like, for example, as I mentioned, kind of those persons are traveling, especially during the holidays. So a lot of the cases are coming from there. So it was not necessarily saying I know the exact amount for as it pertains to children versus adults, because there is a mixture in that 214. But of course, they have reported that it was there were outbreaks in one of the schools, as well as a church there in Spartanburg.
Well, thank you so much for your report. I appreciate it. Thank you. It's good to have you on here.
You're quite welcome. Any other questions?
All right. Well, thank you again. If there's nothing else, we're going to move on to our community health and wellness updates. I did want to introduce Joyce Antonetti. She's with Trident Tech Wellness Center, I think wellness coordinator. Am I right on that, Joyce? Wanted to
recently promoted to the wellness director.
Wellness director. Okay, gotcha.
And we do have 5 campuses that I would like to incorporate all of our wellness initiatives here for the students and the employees. We are in downtown Mount Pleasant, here in North Charleston on Rivers Avenue, our Berkeley campus, which is being renovated, and our Dorchester Marion campus is on Dorchester Road. So we have a lot of impact on the wellness community within the student population, and we're working in tandem with a couple of other schools, actually MUSC, College of Charleston, Citadel, CSU, for the Student Health and Wellbeing Conference, which will be held in May. And I would love to share that information. If anybody is willing to participate in that, I would love to send that out to everyone.
Great. Yeah. If you want to send that to Paul, he can get it out to everybody. And,
excellent.
All right.
And actually, I see Susan Johnson is on here, and she will be the keynote speaker.
Oh, great. Yeah. Very good. And yeah, I want to thank Jonathan. I think Jonathan Kessler, I believe, invited you to come on board, and we certainly appreciate him reaching out to you, and we certainly welcome you on here and excited to have you. So
much.
all right. Okay, Paul.
Kevin, can I go back to Lamar? Lamar, what's
Yeah.
the flu situation in our area?
And Paul, I am so glad you brought that up because I did have that in my notes, and I have a lot of notes. So of course, I'm glad you brought it back up. And so we're right now, we're still dealing with flu and influenza in the area, and of course, not necessarily to be able to tell you the exact numbers. However, we are still battling with that as one of the challenges in the area. That is something that we are experiencing here in the Low Country. But however, what we're just kind of sharing with our friends and family members is making sure that you do the proper, those proper things, such as the same thing when it comes to the measles. We always offer the vaccinations and making sure that you wash your hands. Of course, in the same sense, those are the kind of things to just kind of make sure that we are still, like I said, we're still dealing with it. So in the same sense, those numbers can't give you an exact number right now, but I do know that we're still having that challenge.
Hey, Paul, I will add, South Carolina is one of four of the worst flu states in the country right now. I believe I know Texas is one of them, but anyway, we're in the top four. South Carolina oftentimes gets to be in the top or the bottom. Well, we're in the top of extreme flu cases, so it is pretty bad this year, mainly due to a mutation of the flu virus that is not necessarily encompassed by the current flu vaccine. So yeah, it's going to be a tough year flu wise.
All right. Anyone else for community health updates?
Nick had his hand up.
Oh, yeah, Nick. I'm sorry. Didn't see it.
Sorry, Paul, I didn't. But anyway, I can certainly give an update.
Please do. Yeah.
Yeah, no, I can just say, I mean, from a food bank perspective, just to say, I mean, we're obviously looking at our end of year numbers at the moment. I mean, we've had a particularly busy year. I mean, this year, just to give a sense of what the amount of food that we distributed about 42.5 million pounds of food this last year. December was, in fact, our busiest December on record. We distributed just over 4.2 million pounds of food, and that's the first time we've ever distributed that amount, which again, considering the government shutdown during the end of the year in November, that continued right into December. So clearly the requirement for assistance from food continued right through the holidays, not least given the fact that December was a shorter month. What I will say is one of the things that we're particularly happy about, if you like, is of the food that we distributed, 67% of that is what we refer to as whole food. So that falls within a category of a protein, a dairy, or produce. And about 46% of everything that we distributed. So 46% of that 42.5 million pounds of food that was distributed was fresh produce. So very much a focus on trying to get nutritious food into the houses of our neighbours and those that need it. And obviously, there's the logistical challenges with that. But I think that is something that we've really been focusing on over the past years. And again, as we finish the year, extremely happy by the amount of fresh produce that we've been able to get into the homes of our neighbours that need food.
Thank you, Nick. Appreciate that. Anyone else under community health updates?
I have some to share.
Yeah. Yeah, Susan, thank you for,
Yeah, so I just wanted to share that just kind of an update on Nature at Work that I had shared a few months ago at one of our meetings. We are making great progress. We had our first advisory council meeting in November. I want to call out Morgan Huey. She represents one of our founding members, the College of Charleston, but that was held at the Low Country Land Trust Center for Conservation, a beautiful new building. And we had about 30 members there, really engaged and excited. So we continue to see momentum with that program. And then we also celebrated our Healthy Business Challenge fellows, their graduation also in November. I want to congratulate April Slinkard. She was one of the first cohort statewide representing the city of Charleston. She was unable to attend the graduation, unfortunately, but I have your certificate, so we need to get together.
Thank you. It was a fantastic experience. I cannot even tell you what a meaningful experience it was for me, and I know for the other guys. So thank you so much for the opportunity. It was amazing.
Well, thank you. And that is a great segue to my ask to this group and to you, April. I will put in the chat, and I will also send some information to via email, but we have a form for if you are interested or if you would like to refer someone. We'll be opening up the application process probably about mid next week. And then the next cohort will kick off in mid-February. So would love to, if you're interested, or obviously if you want to learn more about it, you can reach out to April and she can describe more firsthand her experience. So I will share that. And then also some big news. As you all know, we started the South Carolina Healthy Business Challenge back in 2015 as the Charleston Healthy Business Challenge. And Paul and I worked really hard to stand up that program, and we were able to offer it with lots of engagement in the Low Country, all the way through COVID, and then decided to expand statewide in 2022. And we feel like at this point that at the time, there were some other organizations that were doing worksite health promotion and workforce health and well-being. But, we had the Hospital Association's Working Well program. Live Well Greenville did some work, Whole Spire. So there were some pockets around the state of organizations that were really focused on work site health promotion and employee health. And they have kind of all moved in different directions. And so we have been kind of asked by our state leaders to really take this role to the next level. And so instead of being a program, we are transitioning into a membership organization, and we will change the name to the South Carolina Healthy Business Coalition. We feel like this is a really important step for us to serve as our state's, we call ourselves the Chief Wellness Organization, really want to serve this state in all aspects of promoting a culture of wellness at work and a healthy workforce. And so a lot more to come, but I will get with Paul, and hopefully in the next month or two, I can do a presentation to really explain what that looks like. But we will also be combining the membership. We'll have reciprocal membership between Nature at Work, the Nature Health and Business Group, and the South Carolina Healthy Business Coalition. So, wherever you come in, you'll have those reciprocal membership benefits. So we feel like we have a great opportunity to impact the health of this state by taking this next step. And I look forward to sharing more about it with you.
Great. Thank you, Susan. Appreciate that. Anyone else? I did want to mention, Paul, go ahead. I'm sorry.
You go ahead, and then I'll finish up.
All right. I did want to mention that that Dr. Kay Durst sent her apologies for not being able to be here. She's on vacation, and certainly Lamar and Taylor did a good job of presenting this, but she mentioned that she's seeing lots of flu cases, and she mentioned the measles outbreak, and that she's working with schools on the school health committee for health needs in the schools. So wanted to pass that along from Dr. Durst as well. Paul?
Well, two items, and I'm gonna see if I can find the first one. The first one is following up on what Kay was talking about. I sent to y'all the link for the MUSC Boeing Center Impact Study. That's just a great testament to our community to have that in place for our schools, and also for that it's just something we can hang our hat on that has made a great difference in our community. And so I encourage you to take a chance to look at that link I sent you yesterday and just scroll through it and just see some of the good work going on in our local community, because it really does. It is impactful. It's grown out of the Charleston County School District to a whole range of schools throughout our state and beyond. And wow, what a great thought to think it started right here in our Charleston County School District, and now is a champion for many other communities. So congratulations to Dr. Key and that whole team at the MUSC Bowen Center for all they do, and for Maggie and the school district for what our teachers have done, our school system has done for our children. But that report's very impactful, and it's a good testament to what just starting a little walk can do in a community, and with a great team behind it. So anyways, I just wanted to share that one.
Yeah, thank you, Paul.
And then if I could, I would like to just go back to last month's meeting and just ask a couple more questions of everybody. Is we've had a chance to look at it, and I know Lamar's on with Taylor, but we looked at the state plan, and it identified a lot of initiatives statewide that we see here locally, and things from looking at suicide to chronic diseases, physical activity, food insecurity, maternal and infant health, access and affordability, homelessness, life expectancy, mortality issues. What are the ones that you think, we take a lot of broad topics. We try to things, instead of going to city council, we try to bring them here to have the discussion so that we can flesh them out and come out with some recommendations, or working with partnerships. But what jumps out at you that we should maybe take one or two of these initiatives this year and really put some attention toward, that we can bring some items to the mayor and city council that could give the city some input over, or how to address some of these items. But I just throw it out there. I wanted to see if you had any input about what you think we could do locally, and then also, some of these items already are well in place. How can we bring those partners to the table or assist those partners? So just opening up the table for input, so that Kevin could maybe give something back to the mayor and city council as to here's some opportunities for our city. Not everybody at one time.
Paul, I think they're all excellent things to pursue. Obviously, can't do all of them, but I guess I would have to say suicide, because it's part of my role, and we see those numbers ever increasing. We have seen through Major Burgess and North Charleston and DOT that the overpass barriers have been erected on Ashley Phosphate, and then the new overpass of the name of which I can't remember, in order to deter individuals who may be thinking of that method of taking their life. We'd like to see 988 signage. So I know I've spoken with Jen Brush and also with the Suicide Prevention Coalition for the state. And it seems to definitely be resonating with individuals. So we'd like to be able to see more of the same with our waterway bridges and things of that nature. Unfortunately, we've seen a lot of news attention, but also a lot of support recently with the Don Holt Bridge incident, which turned out to be a successful intervention after many, many hours. But I'll stop talking now and let other folks chime in.
Hi, Paul, this is Nick. I mean, maybe this is, I don't know whether this is more from a self-interest perspective, if you like, but also, but understanding a bit more about the extent of it, but also in terms of how it may evolve over time, is around the issue of homelessness. I mean, given how the context is changing, the increase in prices, issues of affordability, what impact is that having on homelessness? I mean, again, we see a number of our neighbors coming through our front door here seeking assistance who are facing issues of homelessness, for example. So, you know, what is that looking like? What is that likely to evolve into, and how are we best prepared to be able to respond to that, both in sort of an immediate but also more longer term context? And again, I say this from a perspective of not truly understanding the nature of homelessness and how the trends are on that. So I just put that out there.
Yeah, I'll echo that with Nick. Of course, suicide's always the top of my list too, just selfishly. But we did just recently host a homeless response mapping system for our 3 counties. Mayor Cogswell came to do a welcome. Hopefully, we're going to be able to share that information. Part of what we try to do is, if each city and area is doing it separately, it's never going to work. So I know Mayor Cogswell has been also trying to get all of the, at least our Tri-County area together. And a lot of our patients are homeless. Probably a lot of Jonathan's are homeless. And so it all connects to, a feeling of despair when you don't have a roof over your head. So that would definitely be one of mine too, because it all kind of goes together. Those folks go in the hospital a lot, they go in jail a lot, and that's not where they need to be. The answer to homelessness is homes that they can actually live in. We can provide all the RVs and outreach teams that we have out here. I mean, we're fortunate to have MUSC and the VA and us and Charleston Center, but we need homes for these folks to live in. And a lot of it attaches, food insecurity. I mean, obviously, there's a golden thread going through a lot of what was on this list,
Okay.
Yeah, I just would add that, I mean, I think a lot of these are connected, and I think we have a lot of expertise in this call on this team. And I think just continuing to I think I said this in December, Paul, like find ways to elevate maybe strategically some of the expertise we have around these issues of suicide and behavioral health, access to food and affordability. I mean, as well as physical activity, it's all connected for a lot of folks. And so just finding ways to communicate that to our city and our community, maybe a little bit better is one idea I have. Like, what are these partners? What are the resources? How do we get this out broadly beyond just this group?
I think that's big.
Yeah.
It's we have plenty at the table, and our cities got a lot of their departments and divisions are so ingrained in it all. And then how are we all tying that together? And so we have a homeless group, a team, and so I'll lean on them to maybe give us a presentation at our February meeting to see what we can at least look at the players that we need to also see that who aren't there that we need to be looking at who we can bring in. I think COVID was such a wonderful opportunity in a crisis situation that to learn who was doing what in our communities, and all these little coalitions created during those times of people who weren't normally at the table. And so I hope they're still in place, and that's what I'll reach out to try to find, see what we can learn from everybody. Well, I will send those questions to you, because every meeting we need to be talking about what are those avenues until we can start scratching off some of these items to do. Because the diabetes is one that always is focused for me, because we hear so much about diabetes, but pre-diabetes, what Lisa Burbidge was doing. We're seeing obesity in our children. We're seeing obesity in other areas, and I think of diabetes, if we don't keep it's not a magical pill out there that, or a shot out there all the time, that we've got to look at that obesity and what we can do with that chronic disease. So those are some of my other thoughts of just, as you look at the bigger picture, there's all those things, and you're right, those golden threads of physical activity, of insecurity, food insecurity, about they're just communication tools waiting for us to get our needles out and start stitching them together. So, all right, well, thank you.
All right.
And Paul, if it's okay, I wanted to just kind of add on to that as well. And just in regards to it now, of course, I do know that we have the Healthy Tri-County as it pertains to an initiative that Trinity United Way was leading. Like I said, we're still waiting this year. Hopefully, we will come back in a space where we are actually being able to kind of go in a space of being provided of who will lead that initiative. I know that was probably the last thing that was reported to the group in regards to that. But I do understand that, of course, we've had assessments, and then we've had data walks and things of that nature that really allows for us, especially in this area of Charleston and the Tri-County, to kind of really find out where we're going with what is best and with all of those 9 priority areas. I know as it pertains to that, you look at what we've seen in the past was just focusing on, access to care. I heard, a few persons mention about the behavioral health that include mental health as well as substance use. Which was one of the main areas. And of course, as the third priority was the clinical preventative services such as immunizations, cancer screenings, as well as diabetes prevention. We just want to go, and all of these, when you look at those areas, heard homelessness and things of that nature, all of them, you kind of intertwine and kind of can kind of, as you mentioned, kind of stitch them all together to kind of work it for the better when it comes to that. Because a lot of times in situations, understanding that a lot of people may look in the space of, if you mention about, I heard Nick mention about those who are unhoused. So it may be where those same persons are facing with behavioral health issues. So you got to go in a space of being able to, kind of tackle one without tackling the other. And when it comes to those challenges, so it kind of works where you're working with one, but you're also battling with another one, and kind of being able to assist those community members as much as possible. It could very well be with that access to care, as I mentioned, where you mentioned the diabetes prevention, because of course we need those persons who needs more access to care in specialization of just diabetes. And of course, when Lisa Lisa and I are working on some projects that are going on, which will, of course, I'll share sooner than later as it pertains to what we're working on from the last meeting. So we do appreciate the opportunity for her and I. We did connect after the meeting, had a long conversation on her way back to Charleston, and we talked for probably about an hour or two. So I got her back to Charleston safely. Just having those conversations in regards to working with those community partners who are out there providing the resources, and then all of us coming together to see how we can assist the community in all aspects of just facing these priorities that we're commonly seeing.
Great. Thank you, Lamar. All right. Anybody else under community health updates?
I just wanted to mention one other thing that we do have a mental health task force, which is really a behavioral health task force at this point. It's drug and alcohol and mental health. And it's this Friday at 8:30 at our office in Charlie Hall. Anyone's invited, but it's a group of providers across even the state that come. But it is a place to find resources and to look for who's doing what and what areas we need help in. So if anyone's welcome to come, it's every other month on the second Friday at 8:30. I can send that to Paul, but if you'd like to come, please email me and we can send you an invite and you get breakfast.
Great, thank you. Paul, did you have something else?
No, I was trying to look at the chat to see what was all in the chat, but I'll make sure that we try to follow up on all those items.
All right. Well, thank you everybody for joining us this morning. We had a good group, we had a great meeting, and want to wish everybody a happy new year. Is there anything else to come before this committee?
Kevin, I would say that Carolyn Murray just said if anybody would like to join her, to reach out to her about discussions.
Yeah. Very good. All right, if there's nothing else, thank you so much for joining us. We appreciate your time. We know it's very valuable, and it's very valuable to us here at the city, and we appreciate you being here and taking time with us. So if nothing else, Happy New Year, and we stand adjourned.
Happy New Year, everybody.
Here.
Thank you.